So it's a very warm welcome to our YouTube channel. This is Optimal Vision Recruitment Services Limited UK and SG Education Nigeria Limited. We are here to serve you. We are here to point you the right direction with regards to travel abroad, with regards to legal immigration, with regards to student admissions to study in Cyprus, in the UK, in Holland, in Spain, and some other countries. We are also your partners for visas to Dubai and Schengen visa applications. If you are in the UK, we are very happy to help you with Schengen visa applications, and we specialize in student admissions. This video is to respond to the series, the loads and loads and loads of inquiries, phone calls, text messages in response to the video that we made concerning the new pathway for healthcare assistants and support workers to come to work in the UK. Now, this video has garnered a lot of response from people across different parts of the world, Africa, Asia, Europe, America, Australia, and we thank you very much for the time you spent in watching the video. We also thank you very much for your support. We encourage you, please, if you have not subscribed, please kindly subscribe to the YouTube channel and hit the notification button so that you'll be able to get notification when we upload a new video, and smash the like button as well and share widely with your friends and colleagues and family. We do our best to provide you with accurate information on travel abroad legally. Now, I want to put a very strong disclaimer here that I am not an immigration lawyer. I'm not an immigration consultant. I am providing information for general knowledge, information that is widely accessible. And the companies that I'm going to mention in this video that are likely to be recruiting healthcare assistants and providing sponsorship visas for them, or COS, abbreviation for Certificate of Sponsorship. I do not work with any of them. They have not paid me to make these videos. And you should do your due diligence before you make any application to any company. And let me say this categorically. Recruitment to work in the UK is FOC. It is free of charge. You do not have to pay anybody to recruit you to come to work in the UK, either as a healthcare assistant, healthcare support worker, senior healthcare support worker, or senior healthcare assistant, or senior healthcare carer, or as a registered nurse, pre-registered nurse, doctor, pharmacist, physiotherapist, occupational therapist, whatever field. It is illegal to pay somebody to recruit you to come to work in the UK. Take note of that. I will repeat that again. It is illegal to pay somebody to recruit you to come to work in the UK. If you are paying somebody to recruit you to work in the UK, then of course you are on your own. Do not give anybody money. Do not pay anyone to come to work in the UK. Thank you. Take note of that, please. And then now I want to go on to discussing about the requirements for coming to work in the UK as a healthcare assistant or healthcare support worker. Obviously, this is a new route, and the requirements are not explicitly stated on the UK government website yet. But one of them that has been mentioned is that the minimum salary that you'll be earning for you to be recruited is over £20,000. I think £20,480, like I mentioned in my previous video. And of course, someone has to show that they have got healthcare training. So obviously you should be able to show that you have got healthcare training in one way or the other in your country of origin, or if you are in the UK, you should have gotten healthcare training from various organizations that provide this healthcare training. If you have worked as a carer or you're working as a carer and you can provide evidence of that and evidence of the training, then of course you might likely be considered. That might be taken into account. So you need to have some training in healthcare. That's basically a fundamental requirement. And then of course you need to be someone who can read and write English. So though not specifically stated in the website, you should be able to show evidence of English language. So if you're able to show evidence of English language, probably by providing OET exam scores, which may not be the band required for registered nurses or for doctors or other fields, then that should be considered. You should also be able to provide academic IELTS exams results, which should not be up to the band that is required for nurses, but should be above the band to show that you can read and write English. So I would dare say that if you have a band in academic IELTS that is 6666, then you probably might be considered. That's just my opinion. That's not what the UK government has said. But obviously, you need to have evidence that you have been able to study in English, you can communicate in English, and the best way to do that, obviously, is English language exams results. Please, if you haven't done English language exams, I might encourage you to start thinking about it, because it's going to be a requirement. You cannot work in an English-speaking country without showing proof that you studied English, and of course that you're up to date in English. And a most recent academic IELTS exams results from British Council or IDP should be enough to show that. And obviously you need to have applied for a job and gotten a job offer. So you should be able to have an employment contract. That should be one of the requirements for you to be able to apply for this visa. Like I mentioned, the company that is employing you has to provide you with a COS, Certificate of Sponsorship. That's the only way that you can now go to the Home Office and then apply for visa. Do not, I repeat, do not be scammed into paying money for visit visa invitation so that you are coming to the UK to do a program that is 1 week or 2 weeks. That's not going to fly. That's not the purpose of this visa or this visa route. You do not come to the UK with a visit visa and then change it to any other visa in the UK. It doesn't work like that. It might work in other countries. It might work in UAE. It might work in America or somewhere else. But if you come to the UK with a visit visa, if you want to change it to any other visa, you have to leave and go back to your country and then apply for the visa you want to apply for. You cannot change a visit visa in the UK to another visa. Please take note of that. So if any company is giving you invitation letter and you are paying them money for you to come to do a program in the UK, and then from there you change to visa to work in the UK, be very, very careful. You might be throwing away your money. You might be wasting your time. So very quickly, having mentioned the requirements that are likely going to be required for you to be able to do or get this visa, let me quickly mention some companies that are likely recruiting for healthcare assistant jobs, and you can check their website and then you'll be able to, of course, apply, especially if you meet the requirements for the job description. Like I said previously, I do not work for any of these companies. You have to do your due diligence and be sure that what you're applying for, you meet the requirements, and then be able to go through it. And please do not pay any more money for any job offer in the UK. One other thing I need to mention before I move on to the companies is, if you've got health healthcare qualifications, you might be able to compare it to UK standard, whether it is up to UK standard. And there is a website for that. It's called NARIC, N-A-R-I-C. Google it. And if you pay their fees, you send your documents to them, they will be able to help you to check these documents, whether it is equivalent to UK version or not. We might be able to help you on that, but please do not call us to ask us about that service. If you want to inquire if we can provide that service, send us a text message at the numbers or the number that we're going to provide at the end of this video. So without much ado, let's get into the action. Let's get into the companies. Please, like I said, I will repeat that for the umpteenth time. These companies have not paid me for this thing I'm doing, and I'm not an immigration consultant. Do your due diligence and apply. And if you are successful, you pass the interview, you will be offered the job, and then they will provide you with COS. And you can apply for the visa and travel with yourself and your family and your children, if you have any. First is Bupa Care. Check their vacancies on their website and then apply for the jobs that are relevant to you. We also have Hallmark Care Homes. They also are recruiting. Check their website and then look at the requirements that they need and see if you meet it. We also have CHD Living. Also check their website. We have Spring Care Homes. We have Cedar Care Homes. We have Midco Care Homes. We have Arms Care Homes. We also have Country Court Care Homes. We also have PS Recruitment. They are recruiting. PS Recruitment International. Check their website. We have Concept Care Solutions. They do recruit. We have Drake Meadows. They do recruit healthcare assistants and nurses, but we're talking about healthcare assistants here now. You can also check MPP Locums. They do recruit healthcare assistants, and they may be able to provide sponsorship. You can also check the website of MSI International. They might be able to provide. We also have Daytime Healthcare. They might also be able to provide you with sponsorship. We also have HCA Healthcare. These ones are also recruiting. Check their website. And we also have Cara Healthcare. That's another group that you might check up. MMA Recruitment do recruit registered nurses. As at the moment, we don't know if they are into senior healthcare as well, but it is worth checking their website. It's worth getting in touch with them. And I will also encourage you to check up NHS hospital websites. NHS hospitals are in a good position to recruit healthcare assistants, senior carers, and be able to provide them with COS. So check NHS hospitals, check care homes, use Google as your friend, and please be diligent. Do not pay someone any money, and make sure that when you are applying, you meet up with all the requirements that they want you to provide. And before I forget, because for you to be able to work in healthcare, you should be able to provide what is called in the UK DBS, Disclosure and Bearing Service. You may not have that in your country, so the best thing you need to do is to get police clearance. And when you get police clearance, attach it to your documents that you are going to use to apply. So that will be able to help you to meet that requirement until you are able to get to the UK, and then your employer can apply for DBS for you, and then you'll be able to start working. So to recap, this video is to help you see the likely requirements for the healthcare assistant and the healthcare support workers visa. We've mentioned some companies that are likely recruiting. Do your due diligence. Please do not pay anyone money. Do not accept visit invitation to come to the UK because that's a road you don't want to go. And please also make sure you get your documents ready. If you want your documents to be verified by NARIC, send us a text message and we'll be able to see if we can provide you that service. And it's going to be for a fee, of course. And then we will be able to point you in the right direction. If we have further information on this, we will keep providing it. But stay tuned and we'll be able to continue to give you more information. Hit the subscribe button, share widely with your friends and colleagues and families and whoever you feel will be able to benefit from this opportunity. And send us a text message, WhatsApp message preferably. Please do not call because there's no way we can respond to all the calls. Send us a WhatsApp message with your inquiries to +44 79 640 19341. And if you are interested in studying abroad, that's what we do, that's what we specialize in. Send us a message, whether you want to start at foundation level, whether you want to do a BSc program, whether you want to do a master's program, whether you want to study in UK, in Cyprus, in Poland, get in touch with us. Whether you want to do a top-up nursing program, whether you want to do a program with your HND, with your OND, get in touch with us and we'll be able to help you get admission, help you get to the UK successfully, and you'll be able to join the loads and loads of our students who have already come to the UK and who are also on their way, because quite a few people are on their way. The admission for April, May, June is open now. February intake is actually going on, and September intake is also on the way as well. If you are ready for that, get in touch with us. Drop us a voice message, drop us a text message on WhatsApp. Please do not call because we cannot pick all the calls. And on that note, I will catch you on the next one. Please, like I say, keep safe. COVID is real. Look after yourself. Look after your family. And I will catch you on the next video. Thank you.